Thermoregulation, Module 10. Your objectives are as listed. Key terms: normothermia is normal body temp, so between 36.5 and 37.2. Hypothermia is a body temp below the 36.2, where hypothermia is above 37.6. Hyperpraxemia is an extremely high body temperature, usually above 41.5, and fever is elevation in the body temp due to a change in the hypothetical set point. Thermoregulation, it's a patient's status in relation to internal temp control. It's the process of maintaining the core body temperature at a nearly constant value. In Fahrenheit, severe hypothermia is below 86, moderate is 86 to 93.2, or moderate, mild is 93.4 to 96.8, and then normal is 97.7 to 99. Hyperthermia is 99.1 to 106.6, and hyperpyrexemia is 106.7. And we know that converting to Celsius is F minus 32 times 5/9 equals Celsius. This goes and does the conversion so that you could see what they are in Celsius, and then it gives you the conversion rate into Fahrenheit below. Causes of fever: it could be acute and chronic infections like bacteria, viruses, fungi, protozoa. It could be mechanical trauma causes tissue destruction, tumors, carcinoma of the pancreas, lung, or bone, acute leukemias or lymphomas, hematopoietic disorders like acute hemolytic episodes, could be vascular accidents like AMI or stroke, autoimmune diseases, metabolic disorders, thyroid crisis, could be drugs, sulfa drugs, iodides, barbiturates, laxatives, and you need to take a careful history of drug intake in any unexplained fever cases. If you have increased release of interleukin, this is most likely the cause of fever in an infectious diseased patient. With a fever, you're going to see an increase in heart rate. Normal is 8 to 12. Typhoid fever, brucellosis, leopards, some disease-related fevers, cardiac conduction abnormalities, an increase in respiration rate, an increase in metabolic rate, acute phase response, fever, hepatic synthesis of the acute phase proteins, leukocytosis. You could have an increased host immune defense via effects of a fever. And this just shows you what the hypothalamus does and what happens if it's not in homeostasis. Risk factors. Any individual, whether it's age, gender, or race, are at risk. Populations at the greatest risk are very young patients. Infants can get very hot or very cold easily, and they can't tell you that they're hot or can't tell you that they're cold, especially infants. You don't want to have too many blankets, not wearing hats if it's cold out, giving long baths, exposing skin to the air when it's wet. So if they start shivering at all, you should automatically take them out of the bath. For very old persons, usually too many clothes, not enough clothes, sponge bath. Poor persons, people that live in a very hot or very cold climate. Chronic conditions that affect thermoregulation: heart disease, diuretic use, hyper and hypothyroidism. Pregnancy automatically increases the body temp by 0.5 Fahrenheit. Neoplasm, anticholinergic medications, and obesity. types of hyperthermia, which is heat syndromes, heat collapse, heat exhaustion, heat stroke. We've talked about malignant hyperthermia, neuroleptic malignant syndrome, serotonin syndrome, and induced hypothermia. Heat collapse or heat syncope, hot environment, long lasting, standing. You end up with vasodilation, the blood pulls to the legs, and then you have a decreased venous return. Sweating leads to volume depletion. You have decreased cardiac output, blood pressure, and brain perfusion, which can lead to fainting. It's common in elderly patients receiving diuretics, and salt and water depletion, and impaired heat dissipation. Symptoms and signs: core temp normal, below normal, or slightly elevated. And the skin is pale and cold due to the increased sweating. You have heat exhaustion, saltwater balance disorders due to heat exposure. Core temp is normal or high, no tissue damage. Water depletion, heat exhaustion. It's seen in acclimatized patients who have inadequate water intake during exposure to extreme heat and strenuous exercise. Excessive sweating, hypovolemia, and hypernatremia might develop. Salt depletion, heat exhaustion. You have heat cramps, call them minors or Stoker's cramps. If after intensive sweating only the loss of water but not of the salt is replaced, then they might become hyponatremia. Painful spasms of the voluntary muscles after strenuous physical work in high ambient temperatures can cause hyponatremia. And then hyponatremia is where fluid moves from the cellular to the interstitial or intracellular and brain. You'll see bradycardia, increase in cranial pressure, central vomiting, confusion, and hypokalemia. You have heat stroke. Definition is a life-threatening illness with elevated core body temps above 40 Celsius. CNS dysfunction, you're going to see delirium, convulsions, or coma. Incident, it increases with global warming and with the frequency and intensity of heat waves. There's two types. There's the classic heat stroke, which is common in children and elderly people, the poor and socially isolated, or someone with a pre-existing chronic disease like CHF, or someone being treated with diuretics, which causes volume depletion, or impaired heat and dissipation and sweating. External heat could be strenuous exercise, high ambient temperature and humidity, and a lot of times it's seen in runners that are not with inadequate conditioning or they're not properly hydrated. Clinical manifestations of heat stroke: critical thermal maximum, a core temp of 41.6 to 42 Celsius for anywhere from 45 minutes to 8 hours. This can cause cell death due to apoptosis. The induction of heat shock proteins is protective. 49 to 50, you'll see cellular necrosis, failure of heat loss, vasoconstriction, sweating ceases. They have dry, red, and hot skin. CNS dysfunction, they'll get confusion, disoriented, apathy, loss of consciousness, seizures, death. They can see tachycardia and hypotension cardiovascularly, respiratory tachypnea and hyperventilation, and then acid, base, and ion balance disorders. You may see respiratory alkalosis and metabolic lactic acidosis. Disorders of hypothermia, you have pathomechanism is mild to moderate cold exposure with thermoregulatory malfunction, normal thermoregulation but extreme cold. Predisposing factors could be prolonged exposure to extreme cold, especially if it's wet and windy, altered thermoregulation, neurologic or psychiatric disorders, alcohol or drug intoxication. It could be sepsis, uremia. Elderlies, infants, impaired peripheral thermal sensing, decreased metabolism and heat production, maxidemia, malnutrition, pituitary insufficiency, could even be an occupational exposure. Local cold injuries, manifestations. You've got frostnip, the mildest form. That's more to your earlobes, nose, cheeks, fingers, toes, hands, and feet. Immersion foot, trench foot. You saw these in shipwreck survivors or soldiers. They're wet, but they're not freezing cold. Stages. Primary hypoxic trauma manifested as three distinct conditions. You have ischemia, which is pale, pulseless extremities, vasoconstriction, increased blood viscosity. You have hyperemia, which are red, painful, swollen feet. And then it'll go into a post hyperemic period, which is the recovery period. Frostbite is freezing injuries. When the tissue freezes, it forms ice crystals between the cells. It interferes with the sodium pump, ruptures of the cell walls. RBCs clump. They have platelet aggregation and thrombosis. Symptoms: you can have pallor, loss of sensation, blister formation is second degree. After 2 days and weeks, it could be third degree, which is tissue necrosis, or it could be healing by scar. Complications: muscular weakness, sensitivity to cold and pain, atrophy, ulceration, even gangrene can set in. Therapy: restoration of core temp, and then you want to gradually rewarm the frostbitten limb by immersion in water. Hypothermia, core is below 35 Celsius. Stages: the first stage is stage of excitement. Maximal muscle tremor, metabolic rate increases, hyperglycemic. They may have increased oxygen consumption, sympathetic activation, vasoconstriction. There could have cold cyanotic extremities. Cardiac output and respiratory rate is increased. Could have cold diuresis. Um, and CNS is apathy, confusion, and disorientation. The second stage is exhaustion. Shivering ceases, the metabolic rate falls rapidly, they become hypoglycemic. They'll see bradycardia, arrhythmias like AFib or AV block. Cardiac output and renal blood flow is decreased. They have decreased breathing, CNS depression like confusion, disorientation, hyporeflexia. In stage 3, this is severe hypothermia, coma, no pupillary reflexes, circulatory arrest, asystole, VFib, cold diuresis, hypoxia of the peripheral tissues. They may get that lactic metabolic acidosis, usually have liver and kidney failure. Hematological disorders, they have that viscosity of blood's increased, hemoconcentration, platelet dysfunction. You may see DIC. Treatment: you want to gradually rewarm a few C's Celsius per hour. If too rapid, you'll get a rewarming shock. Peripheral vasodilation, the fall in the cardiac output, blood pressure, tissue hypoxia. After drop phenomenon, may get cold, peripheral blood reaches rapidly, the body core, hypothermia. Rewarming procedures: it depends on the severity. You want to have a warm room, blankets, warm bath, electric blankets, any type of means by active warming. You want to restore the circulation. They may get arrhythmic drugs. They may have to defib them. They may give them thrombolytic therapy because of the blood viscosity. Collaborative management: underlying causes must be identified. So your treatment depends on the underlying cause, the core temperature, the age, the condition of the patient, but the overall goal is to bring body temperature into normal temperature range before they have the long-term effects. Interventions: remove them from the cold, provide external warming and internal warming measures. Safety tip: core rewarming must be done slowly because you don't want to get any cause of dysrhythmia. You need to cardiac monitor them when they're recovering from severe hypothermia. And you can look at this chart for the consequences. More interventions. These are for hyperthermia. You want to remove excess clothing and blankets, provide external cool packs, give them a cooling blanket, hydrate with cool fluids, whether it's oral or intravenous, lavage with cool fluids, and give them an antipyretic drug. The primary prevention, you want to avoid exposure to extreme temps, maintain the optimal ambient temperature at the home, dress appropriately, and engage in physical activity appropriate to the temperature conditions. Last one to understand for the exam, just um, how do the following diagnoses link to problems with thermoregulation? So just look at each one of those and how do they rate to thermal regulation.